All right, for this route, we're going to be doing the, oh my goodness. Okay, for this video, we're going to be doing the nasal route and the eye route. So I'm going to be using the same dropper bottle. This will be for his nose, and this one will be for his eyes. So what I would do first is, of course, I would wash my hands and I would glove my hands, come to the MAR to make sure that I am preparing the correct medication for the right patient. I'm going to give Cam the Camel his nasal spray as well as his eye spray. So we're going to double check that these are indeed the correct bottles for him. Cam the Camel. All right. Cam the Camel. All right. So then we're going to walk into Cam's room. He's going to give me his full name and his date of birth. Cam the Camel, April 1st, 2001. And I'm going to administer his nasal spray first. So I'll have Cam spray his nose for me. Before we get started. And I will also have a separate tissue with me as well. So I'll have Cam blow his nose. And I will dispose of this and I will keep a new one for me. So I will then clean the tip of the nozzle for him. Make sure that it's clean before inserting. And then I will have him take a deep inhale through the nostril that I'm applicating and have him block the opposite. So for instance, I'm going to start here to the side that's closest to me, which is his left side. So I'll have him block, I'll do it for him, his right side of his nose. So I'll have him block this part of his nose. And then at the count of 3, he will inhale while I spray it simultaneously. So we'll go 1, 2, and 3. Inhale. All right. And then have him dab there a little bit if he has any residue at the bottom. And then we're going to come to the other side. So he's going to flip around for me. In real life, I would go to his other side. And then I will have him block his now left nostril, and I will apply the medication through his right nostril. So we'll have him block it. And then on the count of 3, he will breathe in through this right nostril. So 1, 2, 3. And he will pat his nose. Then after we have applied said medication, I will clean off the nozzle once more and replace the lid for it. But this is not all. Cam also has to get another set of medication. So I have verified that this is the nasal spray, so I will not be putting this in his eye. This is his eye medicine. So I need to verify, okay. He is to get 2 drops in both eyes. So I need to verify once again that this is the medication for him. He is Cam the Camel, born April 1st, 2001. This is indeed his medication. I have a tissue for him. I'll have him lay back to what is comfortable for him. And then I will hold this tissue at the base of his eyeball softly. And I will have this bottle at the tip of his eye, and I will pull down his bottom eyelid here, and right above his eye, I will insert the 2 drops. I'll try to bring it closer so you can kind of see what I'm doing. Bring it closer so you can kind of see what I'm doing. I'm going to give him 1. Oh, I hate it here. One and 2. Okay, and I'll have him pat these eyes here, make sure that he did get the medicine in his eye, and then we would switch sides for him. We'll then hold it here. Then we're going to do the same thing on the other side. Give him the 2 drops. 1, 2. And if he blinks, I just need to make sure that the medicine does indeed make contact with his eye. Pat dry and give him the tissue for any discharge or anything like that around his eye. And then I will dispose of the trash that I had used. Make sure that I take the medication bottles back to the medicine cart. And I will then remove my gloves, wash my hands, and document the date, time, and the state of the patient at the time of at the time the medication was given. And I will document for the correct patient.